This is IRG's Health Talk. Back to Tom Hutler and Shannon O'Kelly.
Back with our first guest today, Dr. Tyson Hawkins, internal medicine practitioner at PeaceHealth Medical Group in Whatcom County. And Shannon, you and I know that the old myth is not necessarily a myth that men won't go see a doctor. We won't ask for directions. We won't go to the doctor. But he's going to talk a little bit about how important it is to get screening for men's health today.
Yeah, Tom, you're exactly right. That is a true fact that men tend to avoid reaching out for help. You're right, directions, medical care, etc. But there is a lot of screening that you can do at various ages as we men age. And it's important to get those screenings done because if you can identify a problem early, we've talked about a lot of things such as cancers, identified early are treatable and survivable. So we want to talk about those screenings we should have at various ages.
Shannon O'Kelly and Dr. Tyson Hawkins.
Dr. Hawkins, welcome to Health Talk. How are you?
I'm doing great. Thanks for having me.
Well, thanks for joining us. Let's talk about your practice. Tell us about your practice, your education, your interest in medicine. Give us the background of Dr. Hawkins, essentially.
Yeah, I'm an internal medicine physician. I work up in Bellingham, Washington, and what that means is that I practice primary care medicine. I take care of adults age 18 until the end, and my interest in medicine started at a young age with just an interest in taking care of people and science and math. And that led me into an interest in studying science and ultimately going to medical school.
Yeah, internal medicine. I appreciate you explaining internal medicine, primary care practice, the difference, internal medicine 18 and older. A lot of internal medicine physicians seem to have a kind of an area of specialty in their practice. Do you have an area that you like?
Yeah, so internal medicine is not a great term. People are often confused about that. I have a lot of patients who talk about how I look at the inside of their body and I may not have any idea about their skin. And so they say, you know, I know you're an internal medicine doctor, but here I have a skin thing. Would you mind taking a look? And in actuality, it just means that we take care of adults only, to be distinguished from a family practice. So we spend our 3 years training in adults only. And at this point, I would say that my interest in the field of internal medicine has a lot to do with diabetes and obesity management, trying to help prevent the metabolic syndromes that occur as we get older.
Yeah, that's a huge area right now, particularly diabetes and type 1 and type 2 and obesity, wellness prevention, just the lack of exercise and weight gain that we see in American population. But we're going to talk about, maybe we'll address that a little bit, but I want to talk to you about kind of men's health. I think that's the area of interest to kind of talk about men's health. And you and I both know probably that men have a tendency to not seek medical attention a lot of times. Sometimes it's the female in our lives that are scheduling appointments or encouraging yearly updates, checkups, etc. So men and men's health is our topic today. And I kind of want to start by just talking about just kind of maybe some screening pathways, you know, what we should be doing maybe in our 20s and 30s and 40s. Is that okay with you?
Yeah, absolutely. And you're absolutely right. It's not uncommon that I'm seeing a man in clinic and I ask him what brings him in and he says, well, you know, my wife said it was time. So you're right. To get to the heart of what the issue is, often it does require hearing what the wife is concerned about.
Yeah, you know, it's interesting. We seem, as a gender, I guess, to always assume that this is going to go away. You know, whatever it is we have, it will go away. And that's what we're kind of banking on. But you and I both know that if you can get in and get engaged in medical care for whatever diagnosis you have, sooner the outcomes are much better. So let's talk about kind of men in our 20s. You know, let's go through that 20 to 30-year-old period of time. Then we'll just take it in kind of age ranges here.
Yeah, so the younger men, this is really the time when we can probably have the biggest impact in the long-term consequences of the metabolic changes or the choices we're making in terms of our exercise habits, in terms of our eating habits. It's certainly not uncommon in this time frame where young men are feeling pretty invincible. They're at the peak of their physical health, and they don't yet feel the consequences of poor dietary habits or lack of exercise. those are the things that slowly creep into their life, and we see the consequences when people are in their 40s, 50s, or 60s. And so the 20 to 30-year-old is a great opportunity to come on in and talk about at least just some education for making some habits that will be lifelong.
More with Dr. Tyson Hawkins coming up next on Como.
It's a Northwest Lifestyle Weekend on Como News. IRG's Health Talk continues.
We continue our conversation with Dr. Tyson Hawkins and Shannon O'Kelly on men's health screening.
Dr. Hawkins, again, thank you for joining us on Health Talk, internal medicine physician, Peace Health in Bellingham. We're talking about men's health, and I thought you did a very good job. We talked about that 20 to 30 range, and really that's an opportunity for young men to really build understanding, a foundation of good diet, exercise, and the importance of doing that early, getting results later in life. What about 30 to 40? It seems like that's a time where I think a lot of men need to get in and be seen for certain screenings.
Yeah, absolutely. One of the great things about people coming in early when they're still feeling well is you're building a relationship with your physician and a comfort level so that when things do start to go awry, your physician knows you and can pick up on things much quicker. When we're in our 30s to 40s, we start thinking about actually doing some blood work and screening for things that we can't see or we're not aware of, in particularly our cholesterol levels and our blood sugar levels. So there's a recommendation that by age 35, we start at least having a baseline level of what our cholesterol and blood sugar levels are. And these are, of course, things that we're not aware of until we actually take a look.
Yeah, one of the things I'm also thinking about, I mean, I don't know what the statistics are, maybe you do, but it's not uncommon for this underlying high blood pressure, this hidden blood pressure that no one knows about unless you're getting it checked annually. I mean, blood pressure is kind of a significant thing anytime, but particularly in the 30s and 40s for men maybe?
No doubt. Yeah, so every time somebody comes in, they're getting a blood pressure check and they're getting a weight check, and you're absolutely right that we can start to see trends. We hate to make a judgment in terms of blood pressure on one reading alone, so if we get somebody who comes in and they're 30 years of age and they have a high blood pressure, there could be a whole number of reasons why it's elevated in that one moment. But if that person is coming in every year or every few years and we're seeing some consistent changes, it's absolutely something that we should be acting upon.
Yeah, I look back at my 30s to 40s, and if I remember right, it was a little while ago, but if I remember right, you're just so busy. You've got your career, you're raising a family. Generally speaking, you probably have a young family, so you're just really focusing on your career and kind of taking care of your family, and we forget to take care of ourselves. And the 30s and 40s seem to be a time where I personally put on some weight. Not uncommon?
Not uncommon at all, and I think you're absolutely right on with the family and the work. The things just pile on into life, and exercise and our dietary habits really start to tank at that point unless we are making a concerted effort to make better choices and make that a priority.
What about the 40 to 50 time period? What's important during that time?
I would just add upon the things we've already been talking about. Starting around the age of 45 to 50, the guidelines are in flux as we speak, but we start talking about cancer screening at that point. We're thinking about prostate cancer screening, and we're talking about colon cancer screening. There's a lot of controversy in terms of prostate cancer screening, and there are no absolute firm guidelines other than that a conversation with your doctor about the risks and benefits of prostate cancer screening should be had. And again, if you're somebody who has a relationship with that physician and they feel like they know you well, that conversation is going to be a lot more fruitful.
Dr. Hawkins, this is great stuff. We're going to have you come back, but I'm looking for you coming back and talking about those golden years of healthcare for men. Let's do that in the near future, but that was excellent information. Thank you so much for your time.
Absolutely.
You've been listening to Dr. Tyson Hawkins, internal medicine practitioner at PeaceHealth Medical. You can go to peacehealth.org to get more information. And Shannon, it is important. We need, especially as we grow older, to get screened for really quite a few things.
Yes, it is, Tom. Again, we've all heard and we've all seen and all read that early identification and early intervention results in better outcomes.